In the early days of the coronavirus pandemic, one predictive model run by London's Imperial College suggested the nation could suffer some 500,000 deaths by August. For the US, the predictions were even more shocking. They predicted some 2 million casualties unless the government moved swiftly. Clearly, so far, the numbers are much smaller, but this particular model was just a theoretical way to determine who'll get infected and who will die if governments took no action. It's a simple tool, but epidemiologists can use models to predict all kinds of things.
I hope it's clear that that's a very simplistic version of what's actually happening. So then we might want to make things a bit more complicated, and we might want to, let's say we're really interested in not just how many people get infected, but we're interested in understanding how many people end up in hospital, because we want to know about the pressure on the healthcare system.
The main changing variable in these models is the quarantine measures. Scientists use the data on new cases before and after lockdowns have been imposed to fine-tune their models. Models help identify the so-called basic reproduction number, a variable that determines the average number of people that get directly infected by one sick patient during the whole period of infectivity. When it's bigger than 1, the number of infected people grows exponentially.
When we started, so that was again in February, March, most of the models that were being developed then and we knew about, they were using previous outbreaks in order to formulate their forecasts and predictions. And what we figured out is how we can use the current epidemic itself.
The main challenge for this model, however, is the lack of data on the true number of those infected with COVID-19, especially since a lot of people seem to be asymptomatic. Scientists at the University of Washington got around this by creating a model that counted not the number of those infected, but the number of deaths.
We knew early on that we don't have enough testing, so we didn't know how many people are infected. And in order to be on the safe side, we decided that we start modeling once we have 50 deaths per location, so per country. And the reason we felt there'll be more stability on deaths. We're modeling a slope of increase, so that's a beta, it goes up or down.
This model remained the most optimistic for a long time until the number of deaths spiked in early May. Today, scientists predict 140,000 deaths by early August, twice as much as earlier predictions. The change in numbers is linked to easing of quarantine measures.
When you start seeing increase in mobility, 2 weeks later, you will see an increase in spreading of the virus. 1 week later, which is 3 weeks, you will see impact on mortality.
Dozens of various models use a number of algorithms, but all of them have one thing in common. They warn against lifting quarantine measures too fast, too soon. Daria D. Goods for VOA News, Washington.